So we are live today at Sakra World Hospital, Bangalore. We have with us Dr. Sreekanth Shetty, Senior Consultant and Head Interventional Cardiologist, to discuss all queries on TAVI. So, I would like to ask some questions on behalf of our viewers, which was asked from the TAVI. So what is a heart valve disease?
So all of us know that the heart has four valves between its four chambers and the arteries, great arteries which arise from the heart. So there are two valves on the right side, the tricuspid and the pulmonary valve, and two valves on the left side, the mitral and the aortic valve. The aortic valve guards the opening of the aorta, so it is between the left ventricle and the aorta. So when the left ventricle pumps blood, it will allow unidirectional flow of blood from the left ventricle into the aorta and not allow backward leak. And at the same time, the valve will be supple enough to open and allow a free flow of blood into the aorta. So when these valves have either narrowing or leakage, we call that valvular heart diseases. There are different causes for valvular heart diseases. Sometimes they are congenital, that means present since the time of birth. Some are acquired, for example, rheumatic valvular heart disease, which is very common in our country, which happens as a consequence of streptococcal throat infection and chronic inflammation of the heart valves. And then in older individuals, valvular heart diseases can happen because of degeneration of the valve. So valve becomes hard and it does not open very well and may leak as well. So for each valve, there may be a unique set of conditions which may cause the valvular involvement. And aortic stenosis particularly is seen in elderly as a part of degenerative process. And sometimes people who have what we call bicuspid aortic valve, they have early degeneration of the aortic valve.
So, doctor, what is aortic stenosis?
So, aortic stenosis is a condition where the aortic valve becomes narrow and does not open very well. And like I explained earlier, there are three main causes. One is congenital, like the normal aortic valve has three cusps. Some people are born with only two cusps. Some are born with a single cusp. So you call, if it is with two cusps, it's called a bicuspid aortic valve. If it is a single cusp, it is called a unicommissural aortic valve. So these bicuspid and unicommissural valves, they tend to degenerate fast and they cause valve narrowing or valve leakage. Then in older individuals, even tricuspid, that is normal valves, degenerate with time, particularly in people who have high blood pressure, cholesterol, diabetes and other such conditions, and the valve becomes hardened, calcified and narrow. So this is what we call aortic stenosis.
So what causes for aortic stenosis?
So I already enumerated a few causes of aortic valve stenosis, like congenital, rheumatic valvular heart disease and degenerative valvular disease are the most common causes of aortic valve stenosis. In some people, aortic valve stenosis was found to happen due to consumption of weight loss medications which have currently been banned. So the current common causes of aortic valve stenosis are bicuspid aortic valve, rheumatic valvular heart disease and degenerative aortic valve stenosis.
So what is the severe aortic stenosis?
So in patients who have very severe narrowing of the aortic valve, because the outflow from the left ventricle is affected, the patient will experience certain symptoms, and also because there is strain on the left ventricular muscle, because the muscle has to push the blood through a narrowed valve. So once the patient starts developing symptoms related to the aortic valve, the common symptoms are angina, that is chest pain, like when they exert, when they climb up a gradient, they feel chest discomfort, just like how patients with coronary artery disease develop angina. Patients with aortic valve stenosis also develop angina, and in this case it is not because of blockages but because of a mismatch between the workload and the blood supply to the heart. So even without blockages, they develop anginal symptoms. And then again, they may develop breathlessness, and breathlessness is because the left ventricle is under strain and the heart is thickened, it is inelastic, it does not relax well, so that causes breathlessness. The third important complaint these patients may have is fainting or near fainting episodes because they have a fixed cardiac output, and when they do physical activity like climbing stairs or going up a gradient, the BP drops and the person may faint. These patients may also experience fainting because of heart arrhythmias such as atrial fibrillation, which is a rapid heartbeat, sometimes due to ventricular tachyarrhythmia, which is also seen to happen in these patients who have poor heart function. And then sometimes aortic stenosis patient also develop what we call complete heart block, because the degeneration of the aortic valve involves the conduction system of the valve and of the heart and cause sudden slowing of the heartbeat. So this is called complete heart block and may cause fainting, which can be life-threatening. And in very advanced condition, the patients of aortic stenosis go into what is called congestive heart failure, where there is leg swelling, breathlessness, abdominal distension, and the patient cannot walk around and is repeatedly hospitalized because of breathing difficulty, for which you need to do emergent treatment.
So what is the symptomatic aortic stenosis?
So I explained all the complaints that a patient of aortic stenosis may experience. So symptomatic aortic stenosis is a patient who has either chest discomfort, breathlessness, or fainting or near fainting episodes.
So what are the severe symptoms?
I explained that already.
Yeah. So how serious is aortic stenosis, also known as a severe aortic valve?
So severe aortic stenosis with symptoms is a dangerous condition, because once the patient develops symptoms in aortic stenosis, their survival becomes shortened. A patient with angina is expected to survive about 3 years. A patient with fainting may survive to 1 to 1.5 years. A patient with breathlessness or congestive heart failure with aortic stenosis survives less than 1 year. So a severe aortic stenosis, which is symptomatic, is life-threatening condition and needs to be aggressively treated.
So how we can diagnose the aortic stenosis?
One is by physical examination. So when a patient has aortic stenosis and is suspected to have aortic stenosis, you confirm that by physical examination, and once you check them with your stethoscope, you will hear what is called an aortic stenosis murmur. They will also have typical patterns of their pulse, with which you can recognize that the patient may be having aortic stenosis. And to confirm the diagnosis, you will do certain tests, such as an ECG, which will show evidence of chamber enlargement, an echocardiogram, which will confirm the presence of aortic valve thickening and aortic valve narrowing, and the severity of aortic valve stenosis, the cause of aortic valve stenosis. And in patients where you have decided on what we call transcatheter aortic valve replacement, you will do additional tests such as cardiac MRI or cardiac CT to determine the size of the valve, the size of the arteries in the groin, information which is useful for planning the procedure.
So what are the treatments of this aortic stenosis?
So the treatment, there is no definitive medicine to treat aortic stenosis. So medicines do not cure aortic stenosis. So when a patient has severe aortic stenosis, the treatment has to be through valve replacement. There are two types of valve replacements. One is to do a surgical valve replacement, which is what SAVR we call, surgical aortic valve replacement, with either a bioprosthetic valve or a metallic prosthesis. And another is transaortic, transfemoral aortic valve implantation, or TAVI, also called TAVR. So these are the two options of treating the severe aortic valve stenosis.
So what is the hard teams?
So like I explained, now there are two options of treatment, either by surgery or by a percutaneous aortic valve implantation, which means either it would be done by the surgeon or it would be done by the cardiologist. So now, what is the appropriate treatment strategy? That has to be decided by a discussion which involves the cardiac surgeon, the cardiologist, and the anesthetist. Fundamentally trying to understand what is the risk of the patient for either of these strategies and what serves the patient well in the short term in terms of best operative risk, as well as long term in terms of durability of treatment. So this kind of decision making is done by a team comprising the cardiologist, the cardiac surgeon, and the cardiac anesthetist. And this team is called the heart team. This decision making process is very important because you guide the patient with the right kind of a strategy so that the patient is served best over the long term.
So what are the process for the treatment evaluation?
So once we diagnose a patient as aortic stenosis, we make a risk assessment for either type of treatment. So we look at whether the patient has any other systemic illness, like for example severe lung disease, severe liver disease, kidney disease, previous stroke, what is the mobility of the patient, is the patient frail. These kind of considerations are taken into account because these will influence the perioperative procedural risk. For example, if you have a patient who is an octogenarian, 80 plus, and surgical risk is high, then you would advise a TAVI. Likewise, even if it's a younger patient but has a very poor lung condition, and therefore when you subject the patient to anesthesia and do an open chest surgery, that patient may not fare well. So you will have to advise a TAVI procedure for that patient. So this kind of systemic assessment also has to be done, and not just a cardiac assessment. Cardiac assessment is to diagnose the aortic stenosis, determine the cause. A systemic assessment has to be done to determine the patient's overall risk, depending upon which you will decide what is the right treatment for the patient.
So what all tests will be done by doctor perform to determine what treatment is right for me?
So for a patient with TAVI, like I said, in addition to ECG, echocardiogram, we'll do chest X-ray, we'll do pulmonary function testing, kidney functions, liver function, and such other tests, and also do cardiac MRI or a CT aortogram to plan the TAVI procedure.
So what is the open heart surgeries?
In open heart surgery for valve replacement, the patient is put under general anesthesia, and after opening the chest, the patient is put on what we call a cardiopulmonary bypass machine or a heart-lung machine. Heart is stopped and the circulation is taken over by the cardiopulmonary bypass pump, and then when the heart is in standstill, the patient's valve is removed and an artificial valve is placed in its position, and then the heart is closed and restarted and the chest is closed, and then the patient is brought out of anesthesia.
So how is open heart surgery performed?
Yeah, so I already explained that. So patient has to be anesthetized, and heart, once you open the chest, then you have to stop the heart and put the patient on a cardiopulmonary bypass, and then do a valve replacement.
So how long does it take to recover from open heart surgery?
The surgery itself typically takes about 3 to 4 hours, and these days in appropriate risk patients, these surgeries are done with predictable outcomes. They are very safe with less than 1% risk. Patient, however, stays in the hospital for about 5 to 7 days, and during the stay in the hospital, the patient will be put through an active process of physical rehabilitation, respiratory rehabilitation, and made to walk. And by the time the patient goes home, the patient would be climbing up and down the stairs. And after that, it takes about 2 to 3 weeks for the wound healing to happen, and provided the course has been uneventful, the patient is expected to be fully functional in about a month's time. So this is how long it takes for recovery from a open heart surgery.
So what are the potential risks or complications of open heart surgeries?
Yes, so in a typical low risk patient, the risk of any major events is less than 1%. Patient can have bleeding, infection, stroke, respiratory failure, and so these are the typical complications that can happen after an aortic valve surgery. But like I pointed out, in an appropriately selected low risk patient, surgical aortic valve replacement is a very safe procedure, and patients really do well.
So who is eligible for TAVI?
Now, over time, the eligibility for TAVI has evolved. So when TAVI started, TAVI was recommended for patients who were very high risk for anesthesia and surgery, like a very elderly person who is above 80 years of age, or a 90-year-old who has to undergo valve replacement. These are very striking examples of who would be eligible for a TAVI procedure. TAVI procedure would also be recommended for patients who, other than for age, for other physical reasons such as poor lung condition, advanced liver disease, or previous stroke or frailty. And for these reasons, a patient cannot undergo an aortic valve, surgical aortic valve replacement. Such patients would be considered for TAVI. However, with evolution of the TAVI technology and proven long-term durability, the risk profile of patients undergoing TAVI has shifted from those who are at high risk for surgical AVR to now moderate risk for surgical AVR. There is good evidence of TAVI as an effective treatment for such patients, and with further refinement of technology, TAVI may evolve into a default strategy for treatment of aortic stenosis in selected patients who are even at low risk of complications during a surgical aortic valve replacement. So TAVI in that sense is moving in the right direction of offering a less invasive, durable, low risk option for patients with aortic stenosis.
So what is TAVI and what are the different approach used to perform TAVIs?
TAVI, the expansion of TAVI is transfemoral aortic valve implantation. It is also called transfemoral aortic valve replacement, or TAVR. Usually it is performed through the groin artery called the femoral artery. However, in some selected patients where the groin artery on both sides may be diseased, you can use other approaches to replace the valve, such as through the axillary artery, which is in the armpit, or using the carotid artery, which is very rarely used, the artery in the neck, and sometimes in where there is no other vascular access, you will also directly implant it through the muscle of the heart from near the nipple, what we call the apical approach. So these are the different approaches to performing a TAVI procedure.
So how long TAVI procedure will take?
A typical TAVI procedure can be done under IV sedation and local anesthesia. Rarely you need general anesthesia for the procedure, and it takes about 1 to 1.5 hours to perform the procedure.
So how long does TAVI valves last?
So the durability of TAVI valves is improving. It depends upon the valve that is used and also on certain conditions of the patient. So TAVI has been in vogue for more than 10 years now. So there is good evidence for durability of TAVI beyond 10 years. So with further improvement in the technology, you can expect TAVI to become a one procedure in a lifetime procedure.
So what is a TAVR, and it is different from TAVI?
TAVR is just another term for TAVI. So TAVI and TAVR are the same.
So are there different types of TAVI valves, and can I ask for the specific valve?
Absolutely. So there are valves of different makes, but primarily they are in two categories: what we call balloon expandable valve, balloon mounted rather, and a self-expandable valve. So there are different companies that make these valves, such as Edwards, Medtronic, Boston Scientific, and Merrill Life Sciences, etc. And all of these valves have been used in hundreds of thousands of patients worldwide, with proven efficacy, safety, and long-term durability. So a patient may choose any of these valves. There may be some circumstances where your doctor might want to choose between a balloon-mounted valve versus a self-expandable valve, depending upon a patient's propensity for developing what we call complete heart block.
So what are the potential risks or complications of TAVI?
the main complication that can happen during a TAVI procedure is bleeding from the access site, that is from the groin area. And the other complication that can happen is stroke, because you are operating inside the aorta. You may displace some plaque which might go into the carotids and then into the brain. Then at the site of implantation, there could be ventricular rupture causing cardiac tamponade. Patient may develop electrical disturbance of the heart, particularly the complete heart block, which may need a pacemaker. Rarely cardiac perforation. Sometimes during implantation of the valve may get displaced, and you may have to deploy it in another location in the aorta and take in one more valve. So these are the potential complications, immediate complications of TAVI. Long-term complications can be valve infection called endocarditis, or valve thrombosis, or valve degeneration.
So what should I expect directly after my TAVI procedure?
So when a patient undergoes a TAVI procedure, in a case of an uneventful procedure, the patient stays in the hospital for 24 to 48 hours. Patient is primarily monitored for any complications such as bleeding, stroke, or development of complete heart block. So if within the first 48 hours, if the patient has not experienced any of these challenges, the patient is ambulated and discharged, and they can quickly get back to their routine life, because there is a non-surgical option, there is no cutting open. Patient's recovery is pretty fast, and they can lead a near normal productive life after the procedure.
With this, we came to an end for today's live show. Thank you so much, Doctor. So for your availability, inputs, and thank you for our viewers for joining with us. If you have any questions and queries, please you can leave a comment, and our experts will like to answer you.